I'm Dr. Barinholtz. I'm joining Dr. Lippy. Dr. Lippy is going to discuss pregnancy and otosclerosis. Bill?
Thank you, Lenny. I feel that of all the work we've done and all the writing we've done, that this is going to be by far the most lasting contribution that we'll make, I think, in the field of otology and otosclerosis. We were all taught that the hearing in otosclerotic patients was made worse by pregnancy. And as you know, I worked and taught in Israel for many, many years. And for some reason, it never dawned on me that some of the ultra-religious women that I was seeing, who had 5, 6, 7, 8, 10, 12 children, didn't seem to have any worse hearing than women who had 1 or 2 or none. Yet we were all taught that they should be worse. So I came back and looked at our data in the United States. We have a huge database. We've done 17,000 stapedectomies. And we picked from the data women who had no children versus women who had children. And we ended up with about 360 ears. The hard ones to find are patients without children. And we compared them by age groups. We did match pairs. And lo and behold, my impression was correct. The hearing in the patients who had had 3 or 4 or 10 or 12 children was no worse to their comparable or to the comparable patient who had no children. Yet everybody knew that the hearing was made worse. I looked in Google. There were over 6,000 references in Google talking about the pregnancy causing decreased hearing. And we had all advised, or many of us had advised our patients not to have more children. And then John Koss felt that breastfeeding was one of the worst parts of the whole thing, so of course we told them all not to breastfeed. So I looked back through the literature. We could get back to 1950, and we looked at all the papers, one after another, that talked about the relationship between pregnancy and otosclerosis. But then I looked at the individual papers, and what they were retrospective papers, studies. And the paper would go like this. The author would send a letter to 200 or 300 or 500 women and say, when did you lose your hearing? And inevitably they would say, during my first pregnancy, after my second, during my third. This was a universal answer. But then I got to thinking that this is a natural thing for women to do. Their life cycle events are centered around their pregnancies. If you ask a man, when he broke his leg, it was when I worked at so-and-so, or playing touch football in college, or after I switched to this job. But if you ask a woman when something happened, it'll be after my first pregnancy, after my second, after my third pregnancy. They relate things that way. So I called Bill Saunders, my chief, and I said, Bill, you taught us all that hearing was made worse in otosclerotic women by pregnancy. How did you know? Do you remember an original paper? And he said, no, Bill, but Wes Bradley remembers everything he's ever read. Call him. So I called Wes, who was then, I'm sure, close to 90, and he was out playing tennis. He came back and he called me, and I asked him the question. And he said, I read that somewhere. Let me look and I'll find it and I'll send it to you. He said, I don't even think it was in English. So he called a few days later and said, I'm sending you the paper, and I got it. And what was it? It was a paper written in 1939 in Nazi Germany. And it turned out that there was a conference. It involved 9 physicians, and it even listed the remarks of each physician. Only 2 thought there was a relationship. But there was a man there from the Nazi Party. Now, because otosclerosis is a hereditary disease, he made the decision that they did not want, anyone who had a hereditary disease having that and spreading it to their children. In other words, he made a eugenic decision because in the Aryan race, they didn't want anything that was hereditary. So there were 79 women in the series. 77 were aborted and sterilized, or aborted or sterilized. And from that horrible paper, all of us, for 61 years, made the horrible mistake of believing that this was true. And we all advised our patients incorrectly. Now, it'll take a while, but it'll get off of Google. In fact, as you know, we've done a larger study now, including more women, and we're about to write about this shortly. And I hope that in the future that all of you will forget Google and read the more recent literature and advise your patients that they can have as many children as they like, they can breastfeed, and it's not going to affect their hearing.